I'm Denise Scarpelli. I work at the University of Chicago, and I'm the Vice President and Chief Pharmacy Officer. I went to undergrad at University of Chicago, and then I went to pharmacy school at University of Chicago College of Pharmacy. And about 20 years later, I decided to go back to school and get my MBA, and I went to Southern Illinois University to receive my MBA. So what inspired me to pursue pharmacy was when I was a junior in high school, I knew I wanted to go into the healthcare field. I wasn't sure if I wanted to be a nurse or a doctor, and there was actually an article in the paper about pharmacy and that there was going to be a shortage of pharmacists, and they said it was a good career for women. You know, you could, work-life balance, you could have kids. And my mother gave me the article. My mother said, "You're going to go be a pharmacist." I had no idea what the profession was. I thought it was a couple years of school. I went to a high school counselor, and they're like, "It's a 6-7 year program." But I said, "Fine, I think I could pursue that." So I decided, based on that article, that it could give me the lifestyle that I thought I could have. So that's why I pursued pharmacy. But I always loved chemistry and biology, but I had no idea what it was. But just decided to do it based on I thought there's a shortage and there'd be job opportunities. So a typical day for me could change from day to day. Because I'm on the administration side of pharmacy, I can be in multiple meetings, and that could be with senior leadership of the hospital, it could be with my own team, it could be doing rounds with my team on the floors. A lot of my job deals with strategy, so I can be meeting with a lot of different senior level individuals around strategies in healthcare, where we're taking the pharmacy. In my organization, pharmacy is a big component of the organization's financial model. So what do we continue to do to grow pharmacy services? So it's a lot of strategic type meetings, meeting with outside vendors, meeting with drug companies because to get access to new drugs, meeting with payers so they make sure that we're a network. So a lot of meetings and strategic planning and financial planning is most of my time I spent with. But it is very interdisciplinary. So I'm meeting with doctors, nurses. I'm part of that senior level leadership team to make sure that the hospital stays financially sound and that we're continue to bring programs to our patients. The hospital that we serve the underserved community. Actually, our hospital is in an area where there's a pharmacy desert, so there's no outpatient pharmacy services, so we really advanced our outpatient services at our hospital to be able to service the community that we're in. So when I first started pharmacy, my favorite reason to go into pharmacy was serving the community. And when I was in pharmacy school, I had the option of either I could be an inpatient pharmacist or I could be an outpatient pharmacist, so I pursued outpatient. When I first started, I worked at a Walgreens. I worked at Walgreens for 20-something years. And I love the fact that patients in the community trusted us. They came to us for all their healthcare needs. There was no doctor or nurse between us. I could tell the patient whatever they needed to do, and I got to know the patients in the community. So it was kind of like that corner pharmacist that the old-time pharmacist that people thought of. And that's what I loved. I loved the interaction with the community. And then as I continued to go on and pursue administration type roles, I had large teams, and I just loved seeing my team and seeing my team be successful and do things for patient care. So my favorite thing of being a pharmacist or being in the pharmacy profession is all the different unique places that you can interact with people and the growth, even coming to an ASHP conference and seeing all your old friends and how big that network is. And that's why I enjoy the practice of pharmacy. So when I started to pursue pharmacy, I knew I would have to, at least learn what it was while I was in pharmacy school. So I became a technician. I worked at a Walgreens. When I graduated pharmacy school, I decided to stay with Walgreens, and I became they called it a floater pharmacist. So I went from store to store. And a couple years after that, I was approached to be a manager. So then I managed a Walgreens. I actually managed a few for them. And about 5-6 years into my career, I was approached to be a supervisor. And a supervisor oversaw about 30-40 stores. And then I was a supervisor for 8 or 10 years. And I kept on having senior leadership approach me to take more on. And they put me through leadership programs. They saw potential. And I just kept on following what they told me to do. And then around 2010, I became a director, a regional director. So I oversaw about 300 pharmacies in the Chicagoland area, and I did that for about 5 years. And then I was approached to come to a health system. And I never thought in my career I would go to a health system because I was known as a retailer or a community pharmacist. And there's not many of us that switch over, because that's what all my friends said, you switched over to the other side. So I worked for a health system in 2017, and I was asked to come on to build their outpatient services. And so I went to University of Chicago in 2017, and I started to build their outpatient services from a retail, mail order, specialty pharmacy, and grew that over the last 5 years. And then about 90 days ago, I became the Vice President Chief Pharmacy Officer at University of Chicago. So I think when I started the profession, I didn't know I had all these opportunities. As the opportunities came open, I always said yes and pursued the next opportunity. I always joined organizations, so I always had that network of people that knew me and knew how to network and make recommendations. I stayed very active in my pharmacy school. Still today, I probably go to my pharmacy school a couple times a year and do lectures with them, so continue to share that message. But when I think about where I came from, I come from a blue-collar family. Both my parents were blue-collar workers, knew nothing about pharmacy. When we saw that article and my mother said, this is what you should do, I never thought I would end up being the vice president of a University of Chicago. But again, it's saying yes to everything. Pharmacy has a very vast, different things that you can do that I don't think people realize. You know, most people, when you think of pharmacy, you think of your corner retailer or a hospital, and that's it. But there's so many different facets that you could do, and it's just listening to that opportunity, saying yes, and trying it. And I always learned that if I didn't like it, there's always another job out there waiting for me. So just kind of building that career path and having mentors through my career take me along the path. And also, I do the same thing to other pharmacy students and help them through their career journey.